Welcome to our step-by-step guide on applying SAM for lower body pain relief. SAM is a wearable ultrasound therapy device designed to accelerate healing and alleviate pain. Before you begin, ensure you have your SAM device, ultrasound coupling patches, power controller, charger, and a clean, dry treatment area. Clean the area where SAM will be applied. This ensures strong adhesion and effective ultrasound delivery. Do not apply over open wounds, inflamed skin, or directly over bony structures. Let's begin with the knee. Remove the foil seal from the ultrasound coupling patch, exposing the gel. Attach the applicator by pressing it firmly onto the gel cup until it clicks, ensuring a secure connection. Peel off the paper liner from the adhesive and press the applicator firmly onto your knee, ensuring full gel contact. Secure the adhesive patches, allowing for comfortable movement while keeping the applicator in place. Position the applicator above, below, or alongside the knee joint, depending on the treatment area. Do not apply directly over a bone that is near the skin surface. Now let's move to the ankle. Position the applicator above or below the ankle joint, ensuring full skin contact. For ankle sprains, position the applicator along the soft tissue near the injury site. Press and hold the power button to turn on SAM. Choose the treatment duration, 1 to 4 hours, based on your specific therapeutic needs. A blue LED light confirms that ultrasound therapy is active. If a red LED appears, the device is actively maintaining its temperature and will automatically resume therapy for optimal performance once it's ready. Once your treatment is complete, turn off the SAM device. SAM is a safe, drug-free solution for pain relief and recovery in the knee and ankle. For best results, follow your treatment plan and consult your healthcare provider with any concerns.